Dr. Manoj Maman is a pulmonary and critical care physician at the Buffalo General Medical Center. He joins us today on Medically Speaking. Doc, thanks for being here today.
Thank you, Mike. I appreciate being here.
So fall is in the air, summer's over, seasons are changing. That brings us to the ever so popular topic of the flu. So if you can, tell us a little bit about flu season, and then we'll get into vaccination and then flu season versus flu shots versus COVID and all that.
Okay, sure. Well, the flu season occurs every fall. I'm thinking when you see the bills out on the field, you think that flu season is coming soon. We're not sure why the flu season comes in the wintertime, but for every winter, flu season runs around late October, November to March. And at that time, everyone in the healthcare field is encouraging everyone to think about flu shots, because this is one of the diseases that has a huge impact to our healthcare system, but we can prevent with flu shots.
Gotcha. So let's get into the flu shot. The pros and cons, proper timing, where you can get it, things like that. So first, talk about the vaccination, the flu vaccination. Why is that so important?
So there's several reasons why the flu shot is very important. One is that the flu itself causes around 400 to 800,000 hospitalizations every year. So it's a very burdensome disease in the United States. It also leads to a lot of deaths in the United States, 70% of them in people over age 65. So the flu vaccine that we have now has been optimized and improved from the 1940s and is very safe and effective in preventing the flu and also preventing severe symptoms from occurring.
Sure. And so, that topic, flu vaccination and even flu season comes on the heels of COVID-19. So there's been an awful lot of talk in the media, in the community, in the medical community about both. First, if you can, explain what are the different symptoms between COVID and the flu?
So flu and COVID-19 have very similar symptoms, and they have both have different intensities of symptoms depending on who gets the infection. So for example, both the flu and COVID can be asymptomatic in some people and fully symptomatic and with severe illness in another person. Two is that both COVID-19 and flu have very similar symptom profiles, including fevers and chills, cough, shortness of breath. Some folks have sore throat. There's nearly fatigue in both syndromes, runny nose or stuffy nose. Both syndromes have body aches and muscle pains. Headaches are common in both syndromes. The only symptom that people in COVID-19 may have that is not present in the flu is sometimes there's a loss of smell or a change in the smell or taste of someone. And that's the single different symptom that we notice in COVID-19 than in the flu, but otherwise it's very similar. You wouldn't be able to tell right away that you had the flu or COVID-19. You may have to have a test to differentiate between the two of them.
Yeah, it seemed like last winter. So, the holiday season through 2019, people are looking back now and they may think that they have had COVID-19 when they were calling it the flu. You fast forward to, fall 2020. Can people get both the flu and COVID-19 at the same time?
Unfortunately, yes. Both. In the past, people have gotten respiratory viruses other than the flu and got infected with the flu. We notice that all the time in the hospital and in the community, and it's known that you can get the flu and COVID-19 at the same time. We're not sure how common it is. It's something that we want to investigate further, but unfortunately, yes, you can get both at the same time.
Sure. So vaccinations obviously have, scientifically been proven to be very successful and extremely helpful to patient care. But for those who are watching, if you can, in a very basic manner, explain how a vaccination does protect you.
So basically, getting live virus, incubate them into chicken eggs, then purifying them from the chicken eggs, and inactivating or killing the virus. And then scientists and companies will then put into flu vaccines that we can inject into a person. That inactivated or killed virus is still recognized by the human body, by the immune system. Our immune system recognizes this inactivated or killed virus, produces antibodies, which it takes around 2 weeks to get a full antibody regimen. So after you get vaccinated, if your body encounters the flu virus, the antibodies will recognize the flu, attach itself to it, and allows the immune system to clear it out and get rid of it from the body. So many times it would prevent the flu from even infecting you as someone who got vaccinated. Or if you did get some type of infection, it would be quickly cleared away because your body has the antibodies present for the flu.
Very, very helpful. So if I'm a parent, should my kids get the flu vaccination? If I'm a senior citizen, is it important for me to get the flu vaccination? Who gets the flu shot these days?
The flu really affects the extremes of age, is what we say in healthcare systems. So folks who are older than 65 or children younger than 5 are the ones who seem to have the most complications from the flu. The CDC recommends anyone over the age of 6 months of age to get the flu vaccine. I would recommend definitely everyone this season over the age of 6 months to go get the flu vaccine. There's very rare exceptions to receiving the flu vaccine, and your doctor would have already told you about it. So otherwise, you should go out and try to get the flu shot.
Sure. And as a practicing pulmonologist, critical care doc, unfortunately, sometimes you're on the other end of those illnesses. If people do contract the flu and or COVID-19, tell us what it's like as a physician, and tell the audience what it's like having to walk through those types of challenges with patients.
Well, in the outpatient clinic, I do always try to advocate for a patient to get the flu vaccine. With these patients I have in the outpatient clinics, patients with chronic lung conditions. And I tell them my experience in the ICU dealing with patients who, due to a flu infection, have severe reduction in ability to breathe on their own and would need a ventilator, a machine that puts air into and out of their lungs through a tube. I mentioned that this is uncomfortable for anyone. Everyone in the ICU would rather not see someone need a ventilator. And for us as healthcare professionals, we feel always a little bit at a loss that someone is requiring a ventilator or some type of advanced life support for a virus that has a vaccine available for it. When we see the horrible consequences of someone who had the flu, we always try to advocate for those patients in our clinic to get the flu shot.
That's great. And it's obviously important for patients to adhere to physician advice, despite, some folks or there's maybe controversy about vaccination overall, but, we're living in unprecedented times when you're talking COVID-19 and, being on the heels of another flu season. So, as we wrap up, Doc, I'm going to hit you with a lightning round with some questions. So as we go through this, give us quick answers here. When should I get the flu shot?
You should get the flu shot at the end of September, October timeframe. And if you didn't get the flu shot, it's not too late. You should always get it before the end of the season.
Does it hurt when I get a flu shot?
Well, yes, it will hurt to get the flu shot. And you may have a local site reaction. So your body, in order to produce the antibodies, will have some type of local site reaction. Some people have it more significant than others. Usually it goes away after 2 to 3 days.
So true or false, I get sick or I get the actual flu when I get my shot?
No, you do not get sick. You do not get infected with the flu. Your body may lead, as a part of making the antibodies and recognizing the flu, it would cause you to feel aches and pains and maybe having soreness at the site. But it's not that you got the flu infection itself from the shot. Sometimes you get the flu before the shot. That's what can happen too.
Where can I get the flu shot?
Well, this year you could get the flu shot in many different places. I think if you go to website kaleidahealth.org, there's links to flu vaccine clinics and locations and times where you can get the flu shot. Also, the CDC helps sponsor a website called vaccinefinder.org that also lists out places where you get the flu shot and other vaccines in our area.
Dr. Manoj Maman, Buffalo General Medical Center, talking about the importance of flu vaccination. Thanks for joining us today on Medically Speaking.
Thank you, Michael. Thank you.